Hello, my name is Mark Slidell, and I am a general pediatric surgeon at Johns Hopkins Children's Center. I went into pediatric surgery because I love taking care of children. I consider it a privilege to be able to help a child, and the opportunity to have an impact on a child's life from a very young age, with the potential for them to have an improved life for the rest of their lifetime, is incredibly rewarding to me. My philosophy of patient care stems in large part from being a parent myself and having 4 small children at home. I have had the experience of having my own child undergo surgery before, and I remember how it felt, and I understand the way as a parent or as a child one would be apprehensive about undergoing surgery. So I try to think about those things and convey a sense of reassurance and understanding as I'm discussing the need for surgery with a family, and really try to put a child at ease as I would hope someone would put my own child at ease. The thing that really defines us as pediatric surgeons is that we are capable of taking care of problems that a child might be born with, known as congenital problems. And some of these may be noticed when a child is first born, and we address them when a child is very small and a newborn. And some of these may present themselves later on in life as a child is going through adolescence and development. So one of the things that I try to bring to this is an approach that is as minimally invasive as possible, so that we make the smallest possible incisions and the child will experience the smallest amount of pain in recovery from any procedure. So even with a newborn, we can use these advanced minimally invasive surgical techniques to improve a child's outcome and try to provide the best healing opportunity and the shortest length of stay in the hospital for that child. Most of my clinical work is focused on what we might refer to as foregut surgery. So I am an expert in caring for problems with the esophagus, the stomach, and the intestines. And I have particular expertise in caring for reflux disease, esophageal disease, and problems with the hepatobiliary system, such as biliary atresia or colorectal cysts. A lot of my research has focused on health disparities or health equity and ensuring that all patients have equal opportunity to have an excellent outcome from their operations and excellent access to surgical care, regardless of where you come from or who you are. And that really extends to my philosophy of caring for patients as well, is that I will approach every patient as if you're a family member, regardless of your background or who you are or how you came to me. I will do my best to care for you and your family as if you were part of my own family. One of the things that I do is I will often use large data sets to really look at this on a population level. And part of why I enjoy that is it gives me the opportunity to have an impact beyond one child at a time in the operating room, and to broaden that impact to affect a community or a population at large. And one of the areas of interest I have is really trying to make sure that our outcomes are equitable and that all children have an equal opportunity to have a successful outcome from surgery. One of the advantages of coming to Johns Hopkins for your surgery is that we have all of the most cutting-edge equipment and the most innovative approaches to caring for children with surgical diseases. Johns Hopkins is really at the forefront of children's surgical care, and I came here after a decade of experience in another part of the country because I wanted to be a part of this, and I felt that this was a great place for me to have an impact on children's lives. When you come to see me for surgical consultation, I will do my best to provide kind and compassionate care, and I will try to answer all of your questions and make sure I've put your mind at ease as your child comes to us for possible surgical care.